Pick one mentor and describe what that person did for you.
Yeah, so the mentor I think of, I did my surgical training in Australia, but I did a fellowship year in Sheffield in England, and I worked with a guy called Alan Johnson, who was the professor of surgery there. And apart from him being probably the most impeccably honest and supportive person I think I've met, he had a lot of expertise in running clinical trials for new technologies, new procedures, new devices. And what I really learnt from working with him was firstly to ask questions, not to assume that everything new is going to be better. Secondly, to actually set about assessing new things properly within the context of randomised trials to actually prove that they're better, or if they're not better, to actually provide evidence to get rid of that new device. And he was incredibly supportive in that year. I learnt a lot from him. He remained supportive over the next decade when I was back in Australia, and we had quite a bit of interaction in terms of bouncing off research ideas. And when I applied for a chair in surgery in another university, he was certainly provided a good reference as well.
What is your advice for trainees and early career physicians?
Yep. So I think if it depends a bit on the context, but if a trainee or sort of someone who's just been appointed to a definitive post, there's an opportunity to set your career up for the rest of your life. And if you're interested in research, if you're interested in working in a sort of university setting, research is important. And you can set up some foundations and sort of building blocks in the first 2, 3, 4 years of your career. And what I've found and seen, both in my own context and in other colleagues, is the opportunity to set up good clinical databases to prospectively follow cohorts of patients, to provide data that you can report accurately so you know your outcomes. That's a foundational building block for, particularly in the surgical area, for understanding particular procedures in particular contexts. There's also an opportunity to build up tissue banks, blood banks. Surgeons have huge opportunities to get hold of clinical tissue in the context of the operating theatre or the endoscopy suite, and we set about building up those foundations. I think you need to think about what your job is, what your interests are, and what your context is. So if you can't do everything, you need to have a look at what are the diseases or what are the procedures that are most likely to be good ones to spend the first part of your career looking at. So you need to think about what are the things you do commonly in your environment. If you do it commonly and others don't, you probably know immediately what you should be looking at. If you've got opportunities to collect patient data, tissues, bloods, etc., to build resources. If you're doing things commonly in your environment, there will be something that you do more of than people in other parts of the world. So my advice would be to spend a bit of time building those foundations and frameworks, collaborate widely with people in other disciplines, and your career should be successful.